Welcome back, everybody. Early this year, thousands of families were in the process of pursuing IVF treatments with the hopes of adding another member to their family. A very exciting time. Well, now, due to the coronavirus, many women are forced to deal with the harsh reality of putting their dreams on hold or possibly even missing their chance of having a child. It can be devastating. So here to talk more about this and what you should do regarding your fertility treatments is Dr. Brian Levine, Director of CCRM Fertility New York. Doctor, thank you for being with us today.
Thank you for having me.
So let me ask you, for those couples who were in the middle of fertility treatment while the coronavirus outbreak really took hold, were they able to continue that process and finish it out?
So for those patients that were in the middle of making embryos or freezing eggs, we were able to complete their cycles. However, for those patients that were planning to get pregnant, unfortunately, we had to stop or cancel those cycles.
Okay, and the fear of transmitting the coronavirus, help us understand where that lies. Is there a possibility of, through this, that you could transmit that on to, say, an embryo or an egg?
So much has changed since the coronavirus hit the news. Initially, people were using an approach for treating the coronavirus similar to the Zika virus. Once we learned that the coronavirus is very much like the SARS virus, and that the likelihood of transferring this on eggs or embryos or sperm were near nil, we felt safe that it was okay to freeze eggs and embryos and sperm.
Okay, I understand. So, but if folks were freezing their eggs or in the middle of the IVF treatments, you said others that were trying to get pregnant, that is, you said, let's just hold off on this. How long do they have to hold off? Because for some folks, it's a timeline that may not be very long, and if they can't get in to get the IVF, they may miss their window.
That's a great question. So on March 17th, the American Society for Reproductive Medicine came out with guidelines recommending that we took a pause. They revisited those guidelines 2 weeks later, and they continued the recommendation that IVF treatments and getting people pregnant was on pause. The newest recommendations will be updated today, effectively 1 month later. And we're hoping that we're going to receive some information that is supportive of trying to get people pregnant. The Society for Maternal Fetal Medicine and the American College of OBGYN have both said that getting pregnant and staying pregnant are not a high risk for getting a coronavirus infection or having an untoward outcome.
Okay, so new information will be coming out today, which is good information. So give us an indication of what kind of advice you have to folks out there looking to do IVF and are just worried about what's to come, because we are hoping that we'll be back to normal sometime soon, but there's no definite on that.
So this pause has been incredibly difficult for many patients. The hardest part has been the lack of clarity of when the pause will end. And so we've been advising patients to use this time to improve their potential outcome. We've been recommending that patients improve their diets, for example, adopting the Mediterranean diet, increase exercise, by social distancing, we hope, but going outside and trying to get some exercise on a regular basis. And we've also been advising patients to take advantage of telehealth solutions.
Okay, yeah. Dr. Levine, we are almost out of time, but we do appreciate your time and what you're doing to help families create that dream of adding to their family, even during this time of the coronavirus. Thank you.
Thank you.